Hello, and welcome to another episode of Real Talk on Renal Cancer, sponsored by the Judy Nicholson Foundation. I'm your host, Laura Esfeller, and this podcast comes with gracious support from Merck. And I'm really excited today to have Dr. Brendan Guercio on our podcast. I've known Dr. Guercio for a long time, and very familiar with his work, and I know he has a lot that we're going to be talking about today. I'm very excited to share with our audience. So, welcome to the podcast.
Thank you. Thank you very much for having me and happy holidays.
Happy holidays to you too. So if you don't mind sharing a little bit, I always like to kind of start with our oncologists on the podcast. How did you become interested in oncology? And was there anything in particular that brought you into genitourinary cancers?
I wanted to be an oncologist um, from an early age, in part due to family experiences, which I think is a very common story for folks in our field. My dad, when I was in college, actually had stage 4 colon cancer, and miraculously, as a survivor, he's very lucky. He's still doing fine. And my mother is also a breast cancer survivor. And so she went through chemotherapy, radiation, surgery, the whole thing. And that was all happening while I was going through my education and making decisions about what I wanted to do with my life, and made me really want to try and help people in the same way that really great doctors help my family. And when I went into genitourinary oncology, it was actually a little bit of a surprise to me because I didn't really have much exposure to it prior to my fellowship training in oncology. But I was very lucky to run across some really great mentors in fellowship at where I was at Sloan Kettering at the time with Gopa Iyer and Jonathan Rosenberg and others who I was working with in a clinical capacity, and they invited me to start working with them on research. And I just was amazed by the rapid advances that were going on in that field and seeing how immunotherapy and targeted therapies were really starting to improve things for patients. And I think I just got very excited about trying to contribute to that.
That's amazing. And congratulations to both of your parents. That's really phenomenal. And it's really just amazing to see how much the field has changed in cancer in general over the last 20 years, but especially just in the last 10 in kidney cancer. I'm thinking, whenever I was diagnosed 8 years ago, it was a completely different landscape than it is now, which is really ironic to think about that 8 years is not a very long time, but just how much has changed in such a little short period of time. So thank you for sharing. So I wanted to ask, I know that you've done a lot of research about physical activity and diet and how that impacts or how that can potentially impact patients and their outcomes. And this is a common topic in the community. I feel like it's twofold. Patients either feel some guilt sometimes for maybe not having a very active lifestyle or great diet before their diagnosis. And then, of course, everybody loves whenever you're diagnosed to go, oh, well, if you would have done this instead, you'd have had, you wouldn't be diagnosed, right? Um, then there's also the impact of what can you do after you've been diagnosed that may potentially help your outcome, right? And so I feel like this is a very common topic that we talk about a lot, but don't always get to hear from researchers like yourselves that have actually studied some of this. And is there anything you can share about your research and how that may impact patients and their caregivers?
Yeah, definitely. I agree. I think it's a very exciting area where we need more research, and patients definitely are interested in it, as I am. When I was in my training, I was lucky enough to be involved in some studies about exercise in large national studies where so we looked at were patients with metastatic colon cancer, actually, who were on chemotherapy. And the patients were nice enough to complete questionnaires that helped to quantify their sort of physical activity level. And when we looked at associations of their exercise with their cancer outcomes, we found that patients who were exercising on a regular basis, nothing overly strenuous, not like running marathons or high intensity interval training, but just sort of, healthy, regular physical activity, seemed to do better in terms of how long it took for their cancer to progress and how well their chemotherapy controlled their cancer. And that was exciting because that was the first time anyone had shown that for patients with stage 4 colon cancer. And there's a lot of theories as to why we found that association. Some people say, well, people who are healthy feel well, so they exercise more, and the people who are feeling well are the ones that are just going to do better on treatment. And that might be part of it. But there is also a lot of data that suggests that exercising might help with tolerating certain treatment side effects, just by keeping you feeling better, feeling healthier. And so if you tolerate treatments better, then you can actually stay on the treatments longer and tolerate higher doses. And that may actually help keep things working better for patients for a longer period of time. And then there are other factors that, in the lab, for example, with colon cancer, insulin may help colon cancer cells grow faster. So there's some research suggesting that having metabolic issues like obesity or high insulin states like people with type 2 diabetes that may potentially help drive colon cancer biology. Um, since that time, I've pivoted more towards diet in the context of kidney cancer and genitourinary cancers. And I think the story is a little different there. I think a lot of the excitement about diet in the context of kidney cancer revolves around how diet may or may not interact with the immune system and the bacteria that live in our gut, which may have effects on the immune system, because immunotherapy is such an important part of treatment for many patients with kidney cancer today, though definitely not all. Um, and the microbiome is just a really interesting area that's been growing exponentially in the past decade in terms of how it might relate to cancer. There were a bunch of studies 5 or 6 years ago that showed that specific bacteria that live in the gut were associated with better or worse outcomes on immunotherapy and in kidney cancer and other kinds of cancer. And, people initially weren't sure whether those associations were real, but recently there was a study called the Tuxedo study that actually did a randomized controlled trial of fecal transplants where they basically tried to give good bacteria to people. And that trial actually was a positive study where they improved how many patients were free of cancer growth and still doing well a year after starting treatment. So I think more and more we're starting to appreciate what the microbiome might mean for patients with cancer. And obviously, the bacteria in our gut eat what we eat. And so, if we feed them different kinds of nutrients, that may influence how they function and what kinds of metabolites they generate.
Yeah, we actually on the podcast recently had Dr. Ibrahimi from City of Hope talking about her paper in Nature Medicine. And so it's microbiomes and probiotic use and all that has been a hot topic, not only on the podcast, but in the community. And I'm actually glad that you brought up the fecal transplant study because I saw a lot of conversation when the community were people were like, wait, does this mean what I think it means? And and but people are interested, right? Because to kind of what we were talking about, I mean, immunotherapy and targeted therapy, which, as you mentioned, are the two most common types of treatment plans for most patients with kidney cancer. Um, can be very harsh drugs, and so to say the least. And so I feel like most patients, especially metastatic patients, want to do whatever they can to improve their outcome. And so I think that's why patients are more open to at least, these trials and seeing what they're about, because anything that we can do to benefit our outcomes is something that we want to learn more about. But it is, I know, such a new and interesting part of the field that I think is we still have a lot to learn.
Absolutely. And I think one of the challenges is, even if the microbiome does matter, we still have to figure out the right way to modify it.
Right.
And even though this study which was called the Tuxedo study that was presented last fall, suggests that fecal microbiome transplant may work, fecal transplants are really hard to scale because you get donations from a healthy donor, but how do you get donations from that one person to everybody? And are all healthy donors the same? In that study, it was actually a person who had the donor was someone who had had a really good response to immunotherapy for a long time. So they thought, well, your microbiome is probably a good microbiome to give to other people, and they were right.
Mhm.
But it's hard to know if that would be true of other folks who are similar. And a fecal transplant may require a colonoscopy. So I actually think that one of the most exciting areas is the other research that's being done about how to modify the microbiome, like the work that was going on at City of Hope with probiotics, because obviously a probiotic is much easier to make and make in a consistent, hopefully safe way, and for patients to take on a regular basis compared to a fecal transplant that might require a colonoscopy or something like that.
Right. Yeah, I agree with you. And I know that there's different research collaborative groups that are working on some trials that hopefully will be coming out in the next year, that will have some, dealing with the microbiome and probiotic usage to your point. And, one thing I always just like to call out though in the podcast is that whenever we're talking about probiotics, we're not talking about what you can get from Costco or your grocery store, right? Like, while those can be great to use with the direction of your physicians. It's not something that, this isn't necessarily the same type of probiotic that we're talking about. These are usually very specialized probiotics that are created in for labs, to your point. So,
Yeah, absolutely. There's even some data that has raised concern that certain probiotics that are over the counter may even be harmful to some people. And so I think really studying which probiotics are helpful and defining how to use them is something that needs to be done before people start doing it on a regular basis.
yeah, I completely agree. Well, I think I know your answer to where you feel like is the most exciting part of kidney cancer research right now, in the field. But, I was just curious, just, I know that you run a clinic and you also are, doing research and we have a lot of, thankfully, we have a lot of what we call early career investigators in the field that they're, hopefully that they're looking towards kidney cancer and genitourinary cancers. And I'm just curious kind of where you think that, like, where you think that we might be in 10 years. I mean, I feel really hopeful that we have a lot of treatments that are coming soon and that we understand kidney cancer a lot more. I feel like we just need to understand the biology a little bit better so we can provide better treatments. But just curious in your thoughts.
Yeah, I completely agree. I think I'd answer in a couple parts. I think the first part is that I'm hoping in 10 years that we're able to recommend specific probiotics and specific diets to people to hopefully make their outcomes better. My research has revolved a lot around studying whether or not higher amounts of dietary fiber might help people do better on immunotherapy, just because a lot of the bacteria that have been shown to be maybe beneficial to folks on immunotherapy tend to be bacteria that we know eat fiber and then use that fiber to generate metabolites like butyrate that might have effects on the immune system. So that's still something that we're studying that I think we need randomized trials as a next step to really prove. But I'm hoping we have really good answers for patients in terms of what they should do with their nutrition going forward. And then I think there's so many exciting areas. Otherwise, it's hard to pick. One that I think is really neat is adoptive T cell therapies. Obviously, immunotherapy comes in many forms, and the form that we usually use are these IV medicines that kind of uninhibit the immune system in a sort of non-specific way. They work well, but they don't always work. And so these new treatments where they're learning how to target T cells, which are part of the immune system, directly to attack a tumor through basically genetic reengineering, are really exciting. They're already standard for some other cancers. And, there's a lot of groups like some of my friends at Sloan Kettering, Dr. Ritesh Kotecha, who are starting to show really exciting results for patients with kidney cancer too. And so it's definitely not a standard approach yet, but I'm hoping in 10 years that'll be another option that can hopefully give patients really long, durable responses, even if they have stage 4 metastatic disease.
Thank you for sharing. I agree. And, I sometimes get asked, Laura, why do you still care so much about kidney cancer? Because I've had a complete response, been really, really lucky. But it's because I know the genetics and the biology and I know my odds. And so I want to see not only more patients to have outcomes like I've had, but, you know, I want to make sure that there's things out there for me if my time comes again. And again, like I look at some other long-term survivors, longer term than me, and I think that we're getting there. I really encourage patients to have a lot of hope because it seems like there's a lot to be discouraged about, but I actually feel really encouraged listening to doctors like yourself and others in the field because I do think that we're making a significant amount of progress in a really short period of time. So, speaking of patients and caregivers, I know that you are really big on shared decision making in your clinic with your patients. It's something that you're very passionate about. And I know a lot of patients and caregivers sometimes feel really intimidated, especially in the beginning of their treatment, because, you know, they don't necessarily have a scientific background. They may have had negative experiences in the medical community before being diagnosed. And so I'm just curious, how do you work with your patients and caregivers in getting them more comfortable and being part of that shared decision-making process? Or if you just have any kind of tips for patients and caregivers that are, they want to be really good partners in that decision-making progress, but they just don't really know how to.
Yeah, I think that is so important for all of medicine, but especially for oncology, because the decisions that we make in oncology are so important for people. And oftentimes the decisions can be pretty complex. And I definitely encourage patients and their family members to ask questions. I think that it's important that people really feel like they understand what's going on and why we're doing what we're doing. And if they have hesitations about it or they're worried that it's not the right decision for them, we as physicians, we want them to be able to feel comfortable saying that so that we can change the plan if it's really not the right plan for them. I think more and more now, there are really great resources too that allow patients and family members to kind of empower themselves and learn more about their cancer, even outside of the clinic, which can help them maybe ask better questions when they go to talk with their clinical team. I do think it's important to make sure that you're going to the right resources, resources that are provided by good patient advocacy organizations like the Julie Nicholson Foundation. I mean, those are good places to look for that sort of information, or but physicians also are always happy to provide information that is either online or in written form that people can read about more if they want to learn more about what's going on. And if people feel conflicted about a plan of care, we often will involve our interdisciplinary tumor board where we can talk about their plan with a lot of experts from different areas in medicine to make sure it really is the best plan for them. And sometimes a second opinion can be helpful for some patients. And there are times when things are really straightforward and a second opinion may not change things. And there are times where sometimes people need to start treatment urgently and there may not be time for a second opinion. But if it's not one of those situations, I think people should always feel comfortable asking for a second opinion if they want one. At a minimum, hopefully it'll just confirm the plan that was already recommended the first time, and that can help them feel more comfortable about things.
I really appreciate that you shared that because I know, you know, and oncology feels like a very personal field for patients. You not that you don't like your other doctors, but patients seem to tend to get really bonded with their oncologist. I know I've done that with my oncologist and I hear that a lot from other patients. So I think, something that I hear is patients get worried or conflicted whenever they feel like they want a second opinion. And to your point, it's not one of those two scenarios where time isn't necessarily of the essence, and all, but it is something that, they go, well, I don't want to upset my oncologist or offend my oncologist. I don't want to be mad at me. We hear those things a lot as patient advocates. And so I think I really appreciate you saying that because it's something that patients really do struggle with a lot of times. And, to your point, it may not always be necessary, but I think it's really important that patients feel encouraged and empowered to seek out a second opinion if they feel like that's what's right for them.
Absolutely.
Um, I imagine oncology can be a little, challenging of a field to be in at times, because of the nature of it, right? Dealing with cancer patients. I know I get a little down when I have to go see my oncologist, even though I really like him a lot. It's not seeing him, it's the fact that I'm sitting in a doctor's office with a lot of other sick people. So what inspires you to, what keeps you motivated, and what I can imagine can be a very challenging field to be in at times.
Yeah, yeah, it definitely is not an easy field to work in. But for me personally, and I think this is true of many, many oncologists, the thing that inspires me most is my relationships with patients. Just like you said, in oncology, the patient-doctor relationship can be really, really meaningful for both the patient and the provider. And just seeing folks dealing with this disease and going through it on a day in, day out basis, and how courageous they are and how they overcome so many challenges. It really inspires us to work harder for them too. And it's it's it would be hard to do it without that. I tried to do scientific research in a laboratory when I was younger before I went into medicine. And obviously, laboratory research is so important. It helps so many people. It's really the foundation of what's given us modern medicine today. So I have immense appreciation and for my colleagues that do that sort of work. But I realized that for me to feel motivated enough to do real hard research, I really needed to be closer to the patient and see the effects of that research helping people in real time. And that really helps me keep going. And I think, just seeing other people working so hard to help make cancer better helps us too. Like our interactions with patient advocates is huge. Seeing patients that are interested to take the time to actually focus on making cancer care better for everyone else too, and working closely with physicians and researchers is that's a hard thing to do. And patient advocates, I don't have to tell you, obviously make a big difference. I think they've really helped, reprioritize funding in the right ways and probably attract more funding to cancer research, which is really key to us making progress. So, there's a lot of sources of inspiration, luckily, and also just seeing the rapid progress that's going on. Because, like you said, this field, even compared to a few years ago, it is looking much brighter every day. And so that bright future really helps drive us forward.
Thank you so much for sharing. I couldn't agree more. And it's what keeps me going too, whenever, it's tough as patient advocates whenever we see friends of ours and fellow advocates, whenever they have gone passed on. But we know that, I wouldn't want the work to stop if something happened to me, and I know that they feel the same way. And so, and you're right, I know the Judy Nicholson Foundation is involved with other kidney cancer organizations and getting additional funding for different research, within the different mechanisms. And I think that that is, always an area where I know, not just the Judy Nicholson Foundation, but other kidney cancer organizations always really encourage patients, caregivers, physicians, anyone that's in the kidney cancer community to be a part of those conversations with Congress, because in the United States, there is a significant amount of research funding that goes through government, and we need that funding in order to keep the wheels moving. So thank you for sharing that. Any final thoughts or last words for our audience?
Just that I hope everyone has a very happy holiday season. And also, just a word of encouragement to always look for opportunities to participate in research. Research is how we make things better. And all of the wonderful treatments that we have today are made possible because of wonderful patients that in the past volunteered to participate. So that's kind of our hope for the future. And obviously, research is always voluntary. No one should ever feel obligated to participate in research. But if they feel comfortable doing that, hopefully they can help make a brighter future for everybody tomorrow.
I love that. Thank you so much. We really appreciate you being on the podcast. Again, I hope everyone has a happy holiday, and we will see you next year. So, thank you again to Merck and the Judy Nicholson Foundation for sponsoring this podcast, and happy holidays, everyone.